So urinary incontinence can be a really extremely it can be extremely family and social disruption for you. And surprisingly common. It's around half of the people by the time they reach 50, half of women have incontinence, and incontinence defining as interfering with your social life or your hygiene. A few drops doesn't matter, but if you're having to stop doing the things that you do or wear a pad, that's incontinence. And it occurs in 1 in 20 women in their 20s, about 5% of women in their 20s. So young women may have to stop their cheerleading or their gymnastics because of incontinence. It's not just from childbirth or from aging. So it's really important in that we find better answers. We have surgical solutions, but before we go to surgery, it's nice if we can find something more um, quickly acting with less trouble and less downtime. So people are starting to look at using lasers. This is a really nice study that was published this month in Obstetrics and Gynecology, Reproductive Biology, respected journal, where they talk about using a laser. Now, the interesting about these lasers is that they only go, the depth of them is about the depth of 2 or 3 pieces of paper. It's actually more shallow than a business card. So it's really, it's a like tiny pinpoint laser made holes that are in a grid, but it's no deeper than several pieces of paper. So it's reasonably safe, and in the right hands, it can really change lives. So these people did the study showing that not only did it help many women with their incontinence, but it also, as a side effect, helped their sexuality. So, uh, worth looking at if you have this problem and asking your doctor about. Now, most of the leaders and the thought leaders using lasers to help with urinary incontinence are also combining it with platelet-rich plasma in a procedure called the O shot, and it seems to enhance the effects of it. Lasers have been known to improve the results and the speed of healing for facial lasers for 15 years. So we're seeing the same thing when you combine the laser with PRP. So ask your doctor about it. If you want to know more about it, there's some links below this video to check out. Hope you find this helpful.